All right. Thank you everyone for joining. I think we might still have a couple people filtering in, but just in the interest of time, we're going to go ahead and start to kick things off. So thank you so much, everyone, for making time today to join us. This Health Research 101 webinar series, this is the first webinar in this new series that we're putting on, hosted with AIHEC, the American Indian Higher Education Consortium, and the University of North Dakota. We're really excited to be hosting this series of webinars that are going to explore a lot of different topics in health sciences, spanning kind of everything from how to begin a career in the health sciences to the nitty-gritty aspects of how you can be involved in research. And it's all going to be oriented towards our tribal college students and faculty and community health stakeholders who have an interest in supporting research that's conducted with Indigenous perspectives in mind and using Indigenous ways of knowing to really ensure that the work is being done in a way that aligns with our values. So we're really excited to kick things off today. Dr. Melanie Nadeau from the University of North Dakota is going to be our first speaker in the series. She's the Vice Chair and Assistant Professor of Indigenous Health at UND, and she's been a really instrumental partner in the work that AIHEC is doing with UND to serve TCU students and faculty with programming that helps encourage more people to explore health sciences careers and research. So we're so excited to have her today, and we're really grateful for her time. And with that, I think I will go ahead and turn things over to Dr. Mel.
All right, thank you. Let me see. So I think I need sharing.
Let me get that set up for you, just a second.
Okay, so I'll introduce myself. Melanie Nadeau, Jawani Giji Goikwe Indigenous, Makwa and Dudum, Mikanak Waju and Dujabar. So Melanie Nadeau, my spirit name is Southern Sky Woman, and I am from the Turtle Mountain Band of Chippewa Indians. I guess, just as she's getting this set up, I'll say that I've been working in this area, research and evaluation, for 20 years now. And when I was asked to do this, and I've worked and lived with tribal communities all of my life. And so I really had a hard time narrowing in on what I wanted to focus on. So, but you can always check out my page at the University of North Dakota. Izzy will share that out. And my CV is on there, and it has a table of contents because I've done a lot of different things. And so you can check out my publications and all the work that I've done there. I have a lot of experiences to share, but I've decided to zone in on one particular experience.
And Dr. Mel, I think we've got the screen sharing set up. So if you want to give that a try, we'll see if that's working.
All right. Okay, can you see that?
Looks good.
Awesome. Okay, so let me get my slideshow going. All right. So, just to give you a presentation overview, I'm going to share my story, just touch a little bit on what impacts our health, touch on some considerations that you'll want to think about when you're conducting research with tribes, touch on translational efforts, and then just put in my plug for, moving forward and the things that I advocate for. And so I graduated from the Turtle Mountain Community High School. Both of my parents are from the Turtle Mountain Band of Chippewa Indians. Unfortunately, they're both, deceased. And, I've experienced a lot of that, a lot of loss, just like many of us have with our families and communities. I think as Native people, we really have a tough road, to walk with the disparities that we live and see, every day. And that really motivated me to pursue a health career. I also graduated from the Turtle Mountain Community College, and kind of poke fun at myself, but I graduated from the Turtle Mountain Community College not once, not twice, but 3 times. And so I'm a first generation college student, and now I'm first generation in academia, and um, I'm very thankful to be here with you all today. And we launched the Indigenous Health PhD program that I'm the vice chair of in 2020. I'm one of the co-founders of this doctoral program, and it's just been such an amazing journey. But that's a conversation for another time. So yeah, over the years, I've had things that have impacted me, a lot of things that have impacted me, especially as a first generation college student. And so I just want to touch on a little bit, touch on those things a little bit that have really impacted me. One of them was this program that, was held back in the day, and it was called Headlands. And it was out in Mackinac City, Michigan. And we're sitting on a bog here. And these Native students are from across the United States. Um, they were either one right out of high school or 1 year. They had 1 year of college, up to 1 year of college. I kind of fit the bill. I didn't. I tried to go straight to the university from the reservation. That didn't pan out too well. So, I ended up going to this summer program, and this really had a huge impact on my trajectory being part of this initiative. Another thing that has really impacted my journey is the Indian Health Service. And so I would go back to Belport every summer throughout my educational pathway. And I worked at the Indian Health Service in a multitude of capacities. I worked in the clinic, respiratory therapy. I followed around a psychologist one summer. I worked in environmental public health. I worked in public health education. And, I just tried to get as much experience at the Indian Health Service, and I just wandered all over the place. And I think that's testament, because at first I was pre-med and I wanted to be a psychiatrist until I followed one. I'm like, I don't want to do that the rest of my life. But I, looking back on it, it is fitting that I jumped all over the place, and that's really exactly what public health is. It's a broad spectrum of areas that you can work on with a given set of tools that you work and work to build your capacity in utilizing those tools to address health issues at the population level. So it makes a lot of sense that I was like that at that time, because little did I know I'd be here today. And then I already mentioned that Turtle Mountain Community College, but the Turtle Mountain Community College, I'm a huge advocate of tribal colleges. Really thankful to be part of this AIHEC initiative, because being, a tribal college alumni 3 times over. And then I worked at the tribal college on the first research study that I was ever introduced to. And I wasn't one of those students that grew up doing research. My parents had both been relocated out of Turtle Mountain. My mom ended up going back, and my parents, they divorced when I was 2, but I would go back and forth. And my dad, he stayed in the cities, and then my mom, she returned to the res, and so I'd go back and forth, and just really thankful that the college was there to keep me on my pathway. And I changed schools so many times over the years, and um, and so I didn't have that experience of going to science fairs or being part of the science, initiatives or anything like that. I did well in school. I excelled in math and science, but I wasn't one of those students that was into the science or science fairs. I guess I just never really had the opportunity, and I changed schools so many times that that just didn't pertain, catch my eye, or I wasn't given the opportunity to be part of those initiatives. So my first experience being part of research was at the Turtle Mountain Community College. I had applied to be a research technician on a genetics and preeclampsia study, and I ended up getting the position, and I served in that capacity for about 4.5 years. And we built a genomics lab and we were the first tribal college that built this lab up to do DNA analysis. That project is still going to this day, and I just fell in love with research by working on that project. And so here's a picture. And, one of the things that are really important when you're working on research studies in tribal communities is that you involve the elders and you involve the youth. Um, this is really focused around the seventh generation principle and the philosophy of, the elders have the wisdom and the youth have the vision for the future. And so it's important to inform your initiatives from both of those perspectives. And we did that with the genetics and preeclampsia study. Here's a picture of the elders. A lot of these elders are passed away, unfortunately. But I learned a lot. I even learned about past research that had been conducted in our communities. And these elders came in and they entertained us. They did the pipetting and all that. But they said, okay, now, we did this for you. Now we're going to ask you to do something for us. And we were like, okay. And they said, we want to know more about cancer, and we want to know more about diabetes. And so those were the priorities. Those were the priorities that deemed by the elders in our community that, not to say other things were not important, but those were the things that rose to the top for them. And so thinking about this as a scholar, mainstream scholars, they'll, go out and they really focus on their area and, really don't normally deviate outside of that area of expertise. But when you're working in Indian country, we approach these elders with a genetics and preeclampsia study. And yes, they took the time to learn about it and they thought it was important and they supported our work. But then they wanted to learn more about cancer and diabetes. And so the PI, Dr. Lyle Best, he spent evenings with them and talking through, and educating them in these two realms. And so the point being is this idea around reciprocity, that working with tribal communities, you should always give, back. You're going in, collecting data, maybe working to improve the health, but also realizing that you're there to serve, and you might be called to serve in a different capacity than the one that you approach the community with. And so to always be mindful of that. And when I was part of this genetics and preeclampsia study, Dr. Best, he really worked to build my capacity. And that's another thing, is working to build the capacity of the community around these things. And so, Dr. Best said, hey, yes, this is, the research study that I got funded, but I don't have to be the face of the community. And so he worked to build my capacity. And I didn't have any experience with research. And so he sent me all over the place and he made me apply for opportunities and he supported me pursuing those opportunities. And this is one of them that he supported me attending. It was a Native Researchers Cancer Control Training Program that was taking place out in Portland, Oregon. And I went out there for 3 weeks and it was very intense. And we learned so much. Like we had a partner and and again, very diverse group, natives and from across the United States, representation from Alaska, representation from Hawaii and the islands as well. And so very diverse group, and going to this Native Researchers Cancer Control Program just really solidified the fact that, hey, I just fell in love with public health. I was no longer interested in pursuing a pre-med. And I think, Creator just knows when you're on your path, because, and we know when we're on the path that Creator has, lined us up for, because for me, that's how I felt. Because once I started pursuing this pathway, the doors just started flying open and I knew exactly that I was doing what I was supposed to be doing. Ironically enough, just last week, I gave a presentation to students that are working with these researchers to this day around these initiatives. And they do have dollars to support tribal college students and undergraduates, Native undergraduates, Native students that are interested in pursuing research. And so if that fits the bill, or if you want to share that information with someone else, feel free to reach out to me and I'll connect you to that team, because they have dollars for Native undergraduate students that are interested in building their capacity in research and conducting research. And so keep that in mind. So point being, we covered a lot of different things, and I just list all the different things that we did at this program. And so it was such a wonderful experience. And when we created the AIHEC opportunity for students that we're currently hosting this summer, that'll be taking place in June, I actually pulled out my books from this when I went to this program and used that to influence how we designed the program at UND. So, because I have that lived experience. And so I was able to model a lot of things after that, and it refreshed my memory really good. I started thinking at this time, about, since I was moving into thinking about population health, I started thinking about, what impacts our health. And so, working in that genetics lab, and anything genes and biology is 10%. And of course, these overlap, and, they're not mutually exclusive. And these are rough estimates, but it gives you a general idea of, the impact and the weight that these areas, how it impacts our health, at what level it impacts our health. So genes and biology, about 10%, physical environment, about 10%, clinical care, about 10%, and then health behaviors and social and economic factors impact our health collectively at about 70%. And that's the realm that I work in. And so, it's broad. It's applicable to many different areas. You can frame the work in a lot of different ways, and I absolutely love it. So I wanted to share a digital story with you. I guess just to take a step back, when I was at that Native cancer control training program, they asked me to come up with an elevator statement. And my elevator statement at that time was, and I actually got on the elevator and tried to say this before the door shut, because a real life example. And I managed to do that, but I wanted to create culturally grounded interventions in hopes of closing the health disparities gaps with our people. And this was almost 20 years ago. And the ironic thing is that my elevator statement has not changed. That's still exactly what I want to do. But I didn't realize, I learned a lot over the past 20 years, and we have a lot of work to do, and especially around data. And I'll talk about some of those data considerations shortly. But one of the methods that I, eventually want to incorporate into my interventions in a meaningful way, once I get to the point of implementing interventions, designing and implementing interventions, is this skill and method of creating digital stories. And so stories are a traditional form of information sharing in tribal communities, and this is a method that really resonates with tribal communities, and it's been used in a lot of different capacities. And I'm sure many of you have heard of examples or seen examples of people using digital story to convey an issue of importance, or to share a story, a personal story. And when we connect through story, it's just so much more meaningful and relatable. So I feel like it's a very good method. And so as part of as part of building my capacity, I was trained on how to do this. And so I went through a couple trainings on how to develop and create digital stories. And I absolutely love it. I had so much fun. And so this particular digital story is why I went into public health. And I incorporated a poem, and the poem that I incorporated, ironically enough, because I made this probably about 8 years ago. And the poem that I incorporated was a poem that I wrote back in Headlands. Remember when I said I went to college, didn't do so good that first year, went to Headlands? Well, this is a poem that I wrote in Headlands. So I dug that up and I incorporated it into my digital story of why I went into public health.
My name is Melanie Nadeau. I am from the Turtle Mountain Band of Chippewa Indians. I am a first-generation college student and the fifth American Indian to ever graduate with a PhD in epidemiology. Yes, I did it, but it wasn't easy. It took a long time to get there. It was the summer of 1991 in Mackinac City, Michigan. I was only 19 years old and had just arrived at Headlands, an 8-week intense summer academic enrichment program designed for Native American students. I was one of 20 students accepted to this program from across the United States. The camp was out of town, in a wooded area, and we would frequent Mackinac Island. It was beautiful there, an island in the middle of nowhere, only bikes and horse-pulled carriages frequenting the island. All of the students accepted came from a life of privilege. They had access to resources, they had a vision, and they knew exactly where they were going and how they were going to get there. I didn't fit in. I wanted to leave. Who was I kidding? The staff intervened. They explained that I was the one who needed to be there, that this program was designed for students like me. Poor, troubled background, full of potential. I decided to stay that day. Not only did I complete the program, I gave a presentation about my people. This is when I began to understand that in order to know where you're going, you need to know who you are. I was so excited to start college. Everything seemed to be moving along pretty good. I got married, I had my daughter, and I was only one class short of finishing my bachelor's degree. Then everything changed. My mother became ill. My mother and father were both from the Turtle Mountain Band of Chippewa. Like my father, my mother had attended boarding school. She was a homemaker. She made the most beautiful star quilts and had always told me to pursue my education. She would say, "My girl, get your education. That is the one thing they can't take from you." She was my biggest cheerleader. Well, we finally found out what was making my mom ill. She had cancer and would pass within 8 months of us finding out. Everything came to a halt. Everything fell apart. My family, my finances, my home. Eventually, I would regain financial stability, put my family back together, and have another place to call my home. It took me years to pick myself back up, but I was determined to keep going. I wanted to honor my mother's life and the life she had given me. Knowing who I am always helped me. Thinking about my parents' teachings, focusing on positive messaging, and knowing the ways of my people. I went on to finish my Master's of Public Health in Community Health Education with a concentration in health disparities, and my PhD in Social Behavioral Health. My name is Jawani Gijigoikwe, and I am on a turtle's walk. My name.
Okay, and so, yeah, I just thinking about the turtle there, and turtles, I was always, it's something that I really love. Turtles is, I collect like knickknacks and have been collecting ever since I was young. And one of the things that really struck me about the turtle is after it passes away, its heart continues to beat for a few days. And so they're very resilient. And I was at a ceremony one time, and they, at the ceremony, the spiritual leader was talking about that the turtle, it's slowest on this land, but it's the fastest in the spirit world. And I thought that was pretty cool. And so a little bit about me professionally. I'm a community-led scholar. I used to say I was a community-engaged scholar, but then I developed into a community-led scholar because my community, they guide and inform everything that I do. I'll have ideas around methodology and, for my study, and I'll touch a little bit on my current study, but we don't have much time. And so, but I went in with ideas around how I would do this, how I would do my study, and my community is like, no, do it like this. And they totally shaped how I approached my work and switched things around, and it just made it that much stronger. And I've had people say, well, is it hard to be a community-led scholar? And it's like, no, actually, it really takes a lot of the stress away because you're letting the community lead your work. And it just, there's nothing but good that can come from that. So I've really enjoyed it. And so I've worked with tribal communities, I've worked with urban American Indian projects, I've worked with a multitude of stakeholders, tribal, national, state. My master's is in community health education with a concentration on health disparities. As a doctoral student, I was trained in social behavioral epidemiology, so I'm a social behavioral epidemiologist. I'm also a trained mixed methodologist. When I was in my public health program at the University of Minnesota, I went outside the school and got trained at the School of Nursing on mixed methodology. And I'm also trained in the application and creation of processes for the implementation of Indigenous evaluation frameworks. And so, just had a lot of fun. And I'll touch a little bit on that too before we wrap things up. And so the one particular project that I wanted to zone in on is this Circles of Tobacco Wisdom. And this is a project that I worked on as a graduate student at the University of Minnesota. And I was put in charge of leading the evaluation for this project. And at the time I was like, oh my gosh, what am I going to do? And I started thinking, what's the difference between research and evaluation? And really started thinking, getting in, because once you put things into practice, like to me, that's when you really learn it, because you really start thinking about it, And so this project really grounded me in how to do research in a good way. And I'm so grateful that I was able to work with a diverse group of elders in the Twin Cities, and many of them were there because of relocation efforts. And so it was just, I learned so much from these elders. And so I'll talk about the project and its implementation, share the experience, and feel free to ask questions after we're done. Hopefully I can save some time for questions. And so the Circles of Tobacco Wisdom is an elder-led, community-based project that was aimed at enhancing tobacco control in American Indian communities. And what's really cool about this is that they ended up using a model that worked really well with an alcohol intervention. And so they said, hey, if this works good with alcohol, let's try it with tobacco. And the elders were right. It actually translated really nicely, and using this model worked very well with tobacco as well. And so, we did everything culturally grounded. I mean, we would start off in prayer. We had a spiritual leader that led our talking circles, and our talking circles were conducted in a traditional way. And so he would start us off with prayer, and he would, say a prayer with his pipe, and then he would pass around the eagle feather. And then people, they talked when they had the eagle feather when we first, and that's how we grounded. That's how we started every single time we met. And, we had our medicines that we incorporated, and the elders that were in the program, they learned how to grow traditional tobacco. And so we really focused on like the harmful effects of commercial tobacco, but we also focused in on the medicinal effects of traditional tobacco use. So commercial tobacco, the harms, and then the medicinal effects of traditional tobacco. And part of that was really trying to revive those teachings. We had cultural speakers that came in from different tribes because our urban American Indian elder community is very diverse in the Twin Cities. And so I got exposed to a multitude of cultural teachings from a multitude of tribes, very diverse tribes, on their teachings around tobacco and its medicinal uses. And not all tribes use tobacco. Many tribes did. And then we also focused on harvesting kinnikinick, which is also known as red willow. And so we'd go out and we'd harvest that and bring it back and process it. And there's some of the medicine here you can see that we gathered and processed as part of that initiative. This is the Asema, the tobacco that my husband planted at student housing in Minneapolis. So, you just work with what you got, right? So, but it was so cool because his plants, they just took off. And if you were, if I could ever have you in my home, I would love to have you in my home. But my home is just full of plants. My whole ceiling is full of plants. I mean, my husband definitely has a green thumb. And so he helped us with this initiative and grew the traditional tobacco. And then elders grew their own traditional tobacco and learned how to process that. And so they have that available and access for use in their ceremonies. And we were really trying to target and change social norms around, and really make that distinct difference between these, because commercial tobacco is very harmful, but traditional tobacco is a medicine. And so the tobacco industry, they really target our communities. I had access to the tobacco archives over in Minneapolis, and I read through boxes of information about how the industry targets our people and educated the elders in the cities about this. And they were just, they were pissed. We had like, I don't know, 3 or 4 elders that ended up quitting smoking, and they had smoked all their lives. But once they found out that they were actually being manipulated by the tobacco industry, they were pissed off. And so they ended up changing their ways. And then, there was elders that would go into the school and educate the youth because they felt like the youth needed to know these things. And then there was also elders that would frequent Capitol Hill to inform policy around tobacco use. And so the Circles of Tobacco Wisdom Elders, as an intervention, they participated in monthly talking circles, quarterly learning sessions. They were able to choose the topic, and the topics in the beginning, they were very, very focused on the individual. But then eventually they wanted to know broader, like how the tobacco industry was manipulating them, like what policy, how could they make change at a policy level. And so they kind of grew in their capacity, thinking about the impact at the individual level, then the community level, then the organizational level, and societal level more broadly, which also includes policy, and then also the cultural impacts of tobacco use. So here's the South Minneapolis cohort, and they designed that turtle that's on their t-shirt. They absolutely love their turtle. Their turtle was on everything. And then they would get to decide who they were going to honor with their t-shirt. And so they would share this t-shirt, and like there was elders that would honor people even if they tried to quit, even if it was just a day. They said, hey, at least they tried, at least they tried. And we want to encourage them to try again. So we want to honor them, even that small step is a huge step to us, because at least they got their mind and their heart in the right place, and they're working for that. And they say, quitting tobacco is a journey, and, to keep working towards that. Here's the St. Paul cohort. And then our spiritual leader was John Poupart. He was the head of the American Indian Policy Center. And I'm not sure if that's still something that he does, but it's been a while since I've seen him, but he was instrumental in this work and really led us through and held the talking circles and guided us through to do this work in a culturally grounded way. And then this is the North Minneapolis group, and we could never get a group picture of this particular group. I don't know why. They were just resistance again, taking a group picture. So we just ended up putting in some individual pictures, and these two were together and a lot, so they got a picture together. But yeah, so you just have to be responsive in your approach when working with tribal communities, and things don't always work out the way that you think they will. So you just got to be creative and responsive and be willing to try different things. We had an elder journal, and they have the turtle in Boston on their journal, and they'd write down their experiences and so forth. Their t-shirt, of course. And then they designed their own brochures, and they decided what content went on their brochures, and their brochures were all unique in their own way. Different content, some of it was similar, some of it was different. But I think the thing that struck me the most is that some of the elders groups incorporated art from their loved ones, and so this was art from one of the elders' grandchildren, and on the front of their brochure. And artists in our communities are really, in my mind, knowledge keepers, and so it's very important to incorporate artists. And I encourage people when they're writing grants and doing this work in Indian country to support our artists and include them in our projects, because they can really bring our projects to life in a way that many times we're unable to do. So artists are very important in the work that we do. And then here's another example of art that was incorporated from one of the elders, and I believe this one was from one of the elders' children that drew this particular piece. You can see how similar that is to their turtle. And they drew this turtle, so yeah, it's kind of cool. And let's see. They also designed their own on American Indian, or not American Indian, excuse me, on American Smokeout Day. They had a quick cold turkey event that they designed themselves, and it was very successful. And yeah, they just needed that support and guidance, and they pretty much did everything themselves, designed the whole thing, and it was a very successful event, and a lot of participation, a lot of attendees at this event, and really influencing those social norms around quitting tobacco, because it is so very harmful to our health. So here's, and we would promote them in the local newspapers, and, just look for opportunities to promote them. And they were in the Circle newspaper in Minneapolis. And one elder said, when I was reading our little article on the Elders Tobacco Project, I was quoted talking about traditional and commercial tobacco. Last year, when we started the program, there's no way that I would have ever said a thing about that, because I was feeling uncomfortable about knowing the difference. I learned a lot in this tobacco project in regards to traditional and commercial tobacco. And then they, when we wrapped up things, they had their turtle on a cake for our final gathering. And then these are plaques that we had made up to honor. So we gave each elder a plaque at the end, and it has the title honoring Circles of Tobacco Wisdom. Elders, and the circle has healing power. In the circle, we are all equal. When in the circle, no one is in front of you, no one is behind you, no one is above you, no one is below you. The circle is designed to create unity. The hoop of life is also a circle. On this hoop, there is a place for every species, every race, every tree, and every plant. It is the completeness of life that must be respected in order to bring about health on this planet. Dave Chief of Lala, Dakota. So with appreciation to the Circle of Tobacco Wisdom Elder for your courage, for your passion, and for your efforts in bringing our community full circle on tobacco issues. Miigwech. And so at this time, I just really started thinking about, research in communities. And some of the things I was hearing was, hey, we're being researched. We have been researched to death. Governments and researchers gather, analyze, interpret, and report data without consent, review or input from the tribal community. Research results are interpreted and presented in language and formats that are inaccessible or inappropriate. Non-American Indian university-based researchers are seen as experts on American Indians, effectively displacing the true experts. And tribal possession of data to prevent misuse. And so, data can't be owned. It's free for everyone. Honest exclamation point, and so we see a lot of, this research happening, and then it's paywalled. And so the community can't even access it. And so we, myself, once I realized this now, ever since then, I all of my work and all of my publications are publicly accessible. And it does cost more money, but I've been fortunate to this day to get the dollars to support to have things publicly accessible. And I think it is very important. So, some of the questions to ask yourself is, how much data has been collected given my population of interest? What are the strengths and weaknesses of the data set given my population of interest? And what do you do if there's no data available? Well, that is the case in many cases. And, in many cases, the data that has been collected for Native people is very poor quality. And so, we just haven't been given the privilege to lead and design data collection efforts in our communities. And so I'm a huge advocate for that. And that's the research that my primary research right now is building and creating this data collection tool that is informed by community that will be administered to the youth using a community informed approach. Right now, the United States, efforts are focused on the Youth Behavioral Risk Survey that collects data, and it's a school administered survey. But unfortunately, in my tribal community, this was pre-COVID, we had 25% plus dropout rate in high school. And so if we're trying to assess risk, high schools aren't the place to look, because many of our highest risks are not there because they have dropped out of school. And so, and then, of course, that tool was not informed by tribal communities. And so a lot of times there's indicators that do not really apply to our community, or the way that things are asked is really not culturally appropriate. And so that's the arena that I work in, and hoping to, I've collected qualitative data I've conducted interviews with the youth. Or my team conducted interviews with the youth. We did talking circles with behavioral health specialists and cultural knowledge keepers and school administrators, as well as interviewed cultural knowledge keepers as well. And then I had a different design when I first went into community, but they, said, no, we want you to interview these people, include these people, do this, and it actually turned out to be an amazing design. So, and I sit on the Turtle Mountain Band of Chippewa Indians Research Review Board, and I have since its creation, so that I feel very privileged to serve my community in that capacity as well. So some of the considerations, that geographical differences exist with communities. So for example, you'll see that in this region, we have a very high rate of cancer, but if you go down south, you see that the cancer rates are not as bad as they are here. And so that, is for various reasons. One of the major reasons that we have a very high rate of smoking in this region, the Great Plains region. And so, I really advocate against the use of national data when it comes to tribal peoples, because we are so diverse, number one. But number two, our data, the way that our data presents, given this diversity, access to resources and so forth, our individual histories with colonization. I mean, there's so many considerations that these geographical differences are very stark. And when you look at national, you're drowning out those differences. And I think they're important. So I say, well, if you can use local data, if you don't have that, because, we weren't privileged in that area to, get data, and we have a lot of work to do. So if you can't get that, look at state. If you can't get state, look at regional. If you can't get regional, then national. And so limitations will also be differ based on what data source you use. And so always thinking through what are the strengths and limitations of this data set, because a lot of times people will use data sets and then when they're sharing how that informed their work, they forget to mention, and those limitations and strengths will actually inform how you view the data and how much credibility, do you want to make a decision on that data based on how it was collected? Is it representative of the population that you targeted? Did you actually get, are the voices that count in that, your target population? So lots of considerations. Tribal priorities often differ from state priorities, and tribal communities are rarely involved in the data collection process. Another thing is health literacy. I typically ask people, hey, what do you think the health literacy level is? And they'll have all kinds of guesses around that, but very seldom do I get someone that says the 3rd grade level. And so, when we're targeting the general population, we want to make sure that we're disseminating information at the 3rd grade level. And when you get educated, you kind of get blindsided and forget about that. But we don't have to do that work. We have people in our community that can translate. So like when I was at the tribal college, working at the tribal college, and I was working on my bachelor's, I was able to translate at that level. Now it would be very difficult for me to do that since I got my doctoral degree, my master's, my doctoral. And so now, but building capacity at community, including community to translate this for me, is actually a benefit for them, and it's a benefit for me. And then of course you have to, disseminate this information to all levels of community. So, make sure that your results are returned to participants. When I was working on the Circles of Tobacco Wisdom project, I would bring all of my data collection back to them, and I'd say, hey, did I get this right? Does this look right? And I leaned on them to educate me, and they'd say, no, that's not what we were trying to say. And they would explain, and, I'd tweak the information, and they said that they never had anyone do that before. And when I gave the information back to them and say, here's your data, the one elder, he said, Mel, he said, I've been part of a lot of initiatives in the cities. He said, and you're the first one that has given me data, and I was just like, wow. And so I make that a priority in my efforts to return this information back to the people that I collected from. And that's the #1 priority for me. And, if I do other things and disseminate at broader levels beyond that, wonderful. But first and foremost should be the people that contribute. Make sure, to be doing presentation at multiple levels of communities, and the inclusion of elders, inclusion of youth, disseminating the results in community appropriate ways. And so whatever ways is meaningful for any given community, being responsive in that approach. Ensure that the information is useful, ensure that the community benefits. And so really, what we hope is through our initiatives is to train and support Native researchers to develop this, community of researchers that have a community connectedness. They have lived experiences. They are able to take culturally grounded approach, and they're able to utilize tribal approaches and inform the work that they do. And so for the survey that I was talking about, I have to demonstrate to my community how this is going to be a benefit. And I say, the relationship with the community will be strengthened. I'm going to build capacity with my initiative. I'm going to work and be collaborative, and the work will be community informed. The research will utilize an Indigenous methods approach, and I'm going to identify innovative ways to improve and sustain community health in the community. And then this is more detailed, just a spin-off of that previous slide, more fleshed out. So recognize that tribes are sovereign nations. They're unique in their policy needs, institutional policies, tribal policies. And then evaluation, how does evaluation and how does research differ? Well, they share a lot of the same methods. They overlap a lot, but evaluation is based on values, and you can use evaluation models using research methods to measure community-wide impact. And so I advocate for those types of models because tribal communities, they want to know the community-wide impact. And then you'll hear people say, because at the general population level, they'll invest in these types of models, but they're very expensive. But I argue and say, well, tribal communities are so small that doing a community-wide project would be, you'd get a good bang for your buck investing in looking at that level. And then you don't have to worry if things are statistically significant, because you're looking, if you have enough people to demonstrate statistical significance, because when you're studying at the population level and doing community-wide impact studies, and that's not so much of a concern. So some of the philosophies around this, and this is from the Indigenous evaluation frameworks created by Dr. Joan LaFrance and Dr. Richard Nichols. And so the land is always stalking people. The land makes people live right. The land looks after us. Focus on centrality of community and family. The community is the place where the forming of the heart and the face of the individual as one of the people is most fully expressed. It is the context in which the person comes to know relationship, responsibility, participation in the life of one's people. The recognizing of our gifts. Everybody in tribal communities plays an important role. Everyone has a strength. The duty of all people, therefore, is to assist others on their path and to be patient when acts and words demonstrate that there are things that still need to be learned. Tribal sovereignty is our expression of nationhood. For each of our tribes, our sovereignty derives from our sense of place, our languages, history, and culture. It's deeper than a legal or political relationship. And I think most important, regardless of what methods you're using and how you're doing the work with tribal communities, is that you're honoring the process. So moving forward, I encourage, support, and advocate for investment in meaningful data collection, investment in data systems for tribal communities, the creation of community, state, and nationwide systems designed to support meaningful data collection in tribal communities, the investment in building capacity at the community level to understand, collect, store, and translate data at multiple levels of the community, and support community-led and informed initiatives. And that's it. Miigwech. Thank you.
Thank you so much, Dr. Mel. We do have just a couple minutes left, but we definitely want to leave space if anyone wants to hop in and ask a question of Dr. Mel. Please feel free to unmute yourself and go ahead. Or you can use the chat if you'd prefer to type a question in the chat. And if we don't have any questions yet, I might just throw a quick one out to Dr. Mel. I know that a lot of the programming that we're focused on doing in collaboration with UND really focuses on students who are at the associates or undergraduate levels. So maybe for a student who's at that stage of their education and maybe is really just dipping their toes into the idea of doing research for the first time, do you have any suggestions for maybe how they can begin that path in a good way, informed by all of the great suggestions that you had and your own experience, doing research in an indigenized way?
Yeah, I mean, fortunately, like compared to 20 years ago, there's we're building capacity across Indian country, and like our doctoral program is one example of that. And we're working to streamline pathways from the tribal college level to the university, to the master's level, to our doctoral program, and creating these online opportunities to get educated and trained in this arena. So, but I would just say that, the key thing for me as a first generation college student was building my network. I wasn't born with social capital, so I had to create that. And so never underestimate the power of a connection. And so connections really do matter, and they matter whether or not you get that opportunity or, whether you hear about things. So signing up for opportunities to, you can see on my CV that I've received like a multitude of travel scholarships that I applied for, and, just pursuing any opportunities that you can, and to expand your network and to be engaged. And so there's a lot of opportunities up there, keeping your eye out for that and just taking advantage of those opportunities.
Thank you. Yeah, and that's definitely something that we hope we can support students with, is just that kind of building out your network, both, with your peer group, with other students who are in the same place in their education, and also, vertically with people who are maybe sometimes it's maybe someone who's only 5 years ahead in their journey, who can kind of advise you on good next steps to take, or maybe it's someone who's a, a mentor who's further along in their research journey and can really help you think about the big picture about where you're trying to go. So, um, well, thank you so much, Dr. Mel. I don't know if we have any last minute questions, if anyone wants to pop in, but thank you so much again for your time. We have in the chat here, we just added a message that has a link to a survey. We would love for you to fill that out for us. It should just take a minute, just a quick survey to help us kind of figure out how we can make even more webinars in the future that pertain to topics that are interesting to our students. We also have a couple other events coming up soon. We have our next Health Research 101 webinar is going to be on February 11th. And that is, let me go ahead and share my screen so you can see. We've got a link to register in the chat if you're interested. This will be on identifying grant funding opportunities for research, so another great topic in this series. And then on February 13th, we're going to have an online info session for TCU students who want to learn more about our 2025 Health Sciences Summer Institute. It's a 4-week program that includes 2 weeks of in-person instruction on the UND campus in Grand Forks. The program is going to take place in June 2025. So we are currently accepting applicants now, and this is a great time if you're at all interested, or if maybe you are in touch with TCU students who might be interested in this opportunity and want to learn more. This is going to be a great opportunity to learn about that directly from our team and from some students who attended the program last year. So again, thank you so much for your time today, everyone. We want to be timely and try to wrap things up on the hour. So we'll go ahead and sign off here, but thank you so much for joining. We hope to see you at more webinars.